Understanding Ankle Lateral Ligament Sprains. The video is created by Dr. Abhinav Gupta and team. In this comprehensive video, we have covered everything about the topic from initiation to the end. A lateral ankle sprain involves the ligaments on the lateral side, such as the anterior talofibular ligament, are prone to injury when the foot turns inward, causing the ankle to roll outward. Lateral ankle sprains are common and can vary in severity, with symptoms ranging from mild discomfort to significant pain and swelling. Prevalence. The prevalence of lateral ankle sprains is noteworthy, as they are one of the most common musculoskeletal injuries. Statistics may vary, but it's estimated that ankle sprains, particularly lateral ones, account for a significant portion of reported injuries. Factors such as sports participation, age, and environmental conditions can influence the prevalence. Implementing preventive measures and early intervention strategies can help mitigate the impact of these injuries. Grading of ankle sprain. Ankle sprains are often graded based on their severity. 1. Grade 1, mild, slight stretching of ligaments without tearing. Minimal pain, swelling, and no loss of function. 2. Grade 2, moderate, partial tearing of ligaments. Moderate pain, swelling, and some loss of function. Difficulty bearing weight on the affected ankle. 3. Grade 3, severe, complete tearing of ligaments or a significant injury. Intense pain, swelling, and considerable loss of function. Difficulty or inability to bear weight on the affected ankle. The grading helps determine the appropriate treatment and rehabilitation for the specific severity of the sprain. Clinical features. Clinical features of a lateral ankle sprain include 1. Pain, typically on the outer side of the ankle. 2. Swelling, immediate or developing over time. 3. Bruising, discoloration due to blood vessel damage. 4. Tenderness, touch sensitivity around the affected area. 5. Instability, feeling of wobbliness or giving way in the ankle. 6. Difficulty walking. 7. Range of motion limitations. These features may vary in intensity based on the severity of the sprain. Seeking medical attention is crucial for accurate diagnosis and appropriate management. Physiotherapy assessment. A physiotherapy assessment for a lateral ankle sprain typically includes 1. History taking, understanding how the injury occurred, the specific symptoms, and any previous ankle issues. 2. Physical examination, palpation, checking for tenderness and swelling. Range of motion, assessing the ankle's movement. Strength testing, evaluating muscle strength around the ankle. Neurological examination, ensuring nerve function is intact. 3. Functional assessment, walking and gait analysis, observing how the individual walks and bears weight. Balance and proprioception, testing the ability to maintain balance. 4. Imaging, if necessary. X-rays or MRI may be used in severe cases to assess for fractures or ligament damage. 5. Patient-specific goals. Identifying the individual's functional goals and expectations for recovery. Based on the assessment, the physiotherapist develops a tailored treatment plan, including exercises, manual therapy, and education to promote optimal healing and prevent future injuries. Several special tests are used to assess a lateral ankle sprain. 1. Anterior drawer test. Assesses the integrity of the anterior talofibular ligament by pulling the heel forward. 2. Inversion stress test. Applies stress to the lateral ligaments by turning the foot inward. 3. Talar tilt test. Checks for inversion or eversion stability by tilting the foot. 4. Squeeze test. Compression of the tibia and fibula to assess for syndesmotic, high ankle, injury. These tests help evaluate the stability and integrity of the ligaments in the ankle, assisting in the diagnosis and classification of the sprain's severity. It's important that these tests are conducted by a qualified healthcare professional for accurate interpretation. Physiotherapy management. Rehabilitation for a lateral ankle sprain is typically phased and may vary based on the severity of the injury. Here's a general day-wise guide. Day 1 to 3. RISE protocol. Rest, ice, compression, and elevation. Pain management. NSAIDs if recommended by a healthcare professional. Protective support. Use a brace or bandage for stabilization. Day 4 to 7. Gradual weight bearing on the ankle is tolerated. Range of motion. Gentle movements to maintain flexibility. Proprioception exercises. Balance exercises to improve joint awareness. Week 2 to 3. Strengthening exercises. Gradual introduction of resistance exercises for the ankle and surrounding muscles. More weight bearing. Increase weight bearing activities as pain allows. Functional activities. Incorporate activities that mimic daily movements. Week 4 and beyond. Advanced strengthening. Progress to more challenging exercises. Sport-specific activities. Tailor rehabilitation to specific activities if applicable. Focus on full range of motion. Work on restoring normal ankle mobility. Throughout the rehabilitation process, it's crucial to monitor progress, adjust the plan based on individual responses, and consult with a physiotherapist or healthcare professional for guidance. Returning to sports or high-impact activities should be gradual and guided by the individual's recovery. Complications associated with a lateral ankle sprain may include 1. Chronic instability. In some cases, the ligaments may not heal properly, leading to persistent instability. 2. Recurrent sprains. A history of ankle sprains may increase the risk of future injuries. 3. Joint stiffness. Prolonged immobilization or inadequate rehabilitation may result in reduced range of motion. 4. Tendon injuries. Severe sprains can sometimes damage tendons around the ankle. 5. Arthritis. Chronic instability or repeated injuries may contribute to the development of osteoarthritis in the ankle joint over time. 6. Compartment syndrome. In rare cases, severe swelling can lead to increased pressure within the tissues, compartment syndrome. Seeking prompt and appropriate medical attention, along with following a comprehensive rehabilitation plan, can help minimize the risk of complications and support a successful recovery. Surgical options for lateral ankle sprains are generally considered when conservative treatments fail to provide relief or when the sprain is severe. Surgical interventions may include 1. Ligament repair or reconstruction. Surgical repair of torn ligaments or reconstruction using autografts or allografts. 2. Arthroscopy. Minimally invasive procedure to assess and treat joint conditions, including removing loose fragments or repairing damaged ligaments. 3. Syndesmosis repair. For high ankle sprains, surgery may be needed to stabilize and repair the syndesmotic ligaments. 4. Osteochondral lesion repair. Addressing damage to the joint surface or cartilage, which can occur with severe ankle injuries. Surgery is generally considered a last resort, and its necessity depends on the specific circumstances of the injury. Post-surgical rehabilitation is crucial to regain strength, stability, and function. The decision for surgery is made in consultation with an orthopedic surgeon based on the severity of the sprain and the individual's response to conservative treatments. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.